Oh, hi. So glad you could make it. This is my professional development presentation. I am Ashley Warren, and today I will be presenting on the topic Understanding, Assessing, and Treating Grief Following Complex Medical Diagnosis, specifically autoimmune disease. I thought that this would be a worthwhile topic for professional development, as a lot of research has shown that since the COVID pandemic, there's been an increase in diagnoses of autoimmune disease. So, our learning objectives for this presentation is first, we want to develop a greater understanding of the mental health challenges one may face post diagnosis of an autoimmune disease in order to better serve clients we may work with facing autoimmune issues. Next, we'll identify assessment tools that could be beneficial when assessing for grief and other mental health symptoms post diagnosis of an autoimmune disease. And finally, we'll look at education surrounding best practices for selecting evidence based assessments and therapeutic treatment interventions when addressing grief symptoms in the counseling setting following a diagnosis of an autoimmune disease. So, before we jump into the really fun stuff, let's talk about what an autoimmune disease actually is. According to the Cleveland Clinic, an autoimmune disease or autoimmune diseases are health conditions that happen when your immune system attacks your body instead of defending it. Healthcare providers sometimes call them autoimmune disorders. So you may be saying, hey, Ash, how is this even relevant for us as counselors? What are we, rheumatologists? I'm going to talk to you about the relevance. So you may see on this slide a number of different statistics, and you may Google these stats and find various numbers. This comes from a lot of research that was done recently that the Cleveland Clinic compiled together. So you might find other numbers depending on the source. So let's just agree that there are a lot of people living with an autoimmune disease. According to the Cleveland Clinic, there are at least 105 types of documented autoimmune diseases. At least 15 million people in the United States live with at least one autoimmune disease. 63% of those diagnosed are females. Let me just say, this is one of the big statistics that you will find that varies in percentage based on the source that you're looking at. I saw upwards of 80% of those diagnosed are female from another source. Everybody agrees, though, from every source, females are the ones primarily diagnosed with autoimmune diseases. Moving on, 24% of those diagnosed are diagnosed with at least two separate autoimmune diseases. 8% of those diagnosed have been diagnosed with three different autoimmune diseases, and only 2% of those diagnosed are diagnosed with four or more autoimmune diseases. With statistics like that, it's almost certain that many of us are dealing with people that are either affected themselves by an autoimmune disease or will become diagnosed with an autoimmune disease sometime in their life, or we ourselves are affected by autoimmune diseases, or the loved ones of people that we work with are affected by autoimmune diseases. With such a large number, it's pretty evident that if we're working with the population at all, that we will encounter autoimmune somehow in the work that we do. Moving on, I'd like to just talk for a second about why being educated about autoimmune disease and how we can be informed clinicians is important to me. So on this slide, you can see a picture of my mother. She would have been in the second grade, I believe here. I know it's a blurry picture. Trust me, she's cute. However, her bones and joints were not, because it was around this age that she was diagnosed with juvenile rheumatoid arthritis that later rolled into rheumatoid arthritis for her. So she had it when I was conceived, as well as throughout my upbringings. I remember I was probably in the second or third grade when she went to see a doctor and was told, unfortunately, that she had the joints of an 80-year-old woman, although she was in her late 20s at the time. So we started going to Loyola Hospital in Chicago for some experimental treatments and therapies that they were doing back then to try to assist in getting her into remission. And some of those were successful for a while, but I also got to see the devastating side of living with autoimmune disease too from a very young age. So the top five autoimmune diseases that we typically see in the United States are rheumatoid arthritis, psoriasis, type 1 diabetes, Graves' disease, and autoimmune thyroiditis. Autoimmune diseases can affect joints and muscles. So some examples of that might be, again, rheumatoid arthritis or lupus. Skin and blood vessels can be affected. Psoriatic arthritis and Sjogren's syndrome would be an example of those. Digestive system might be Crohn's disease or even celiac disease. Endocrine system, Hashimoto's and Addison's disease would be two examples of that. And the nervous system, so MS and myasthenia gravis would be a good example of those. Next up, let's look at some factors that increase risk of developing autoimmune disease. So there does seem to be a genetic predisposition. Certain gene variations can make a person more likely to develop an autoimmune disease in their lifetime. When we discuss genetics, it's also important to mention family history. So autoimmune diseases often do run in families. So if you have a close relative with an autoimmune disease, you might be at increased risk. So yay for me, right? Thanks, Mom. Next, we have immune system factors. So if you've struggled with low immune system, infections, those kinds of things, that can trigger an autoimmune response, making you more at a higher likelihood to develop an autoimmune disease. One thing that I didn't mention on this slide that may be kind of in with genetics is we did mention earlier, if you were born female, you have a higher risk for developing an autoimmune disease. I also mentioned environment, and I'd also like to include just overall lifestyle. So smoking, being exposed to different toxins and chemicals, partaking in a Western diet, so things that are high in saturated fats, processed sugar, and just processed foods, complex carbohydrates that might promote inflammation or gut health issues, being overweight, and then having to take certain medications such as antibiotics or certain blood pressure medicines have led to the potential for increase in potential autoimmune issues, as well as exposure to UV light has also been documented to increase risk of developing autoimmune disease. Next up, how do specialists diagnose autoimmune diseases? So one of the ones that I commonly hear around here, or something that they many times will start with, is the ANA test. And then there are a bunch of different types of tests that I included on here as well. One of the things that I did not include on this slide is things like x-rays and MRIs, just to view. So if they're looking for like rheumatoid arthritis or other types of inflammation, sometimes you're dealing with inflammation that we can see. So many times when we're looking at diagnosing or ruling things out, that will be included. I did not include that on this slide though. I thought this picture was funny and not funny at the same time, because I have so many clients that deal with this. They look just like that girl on the slide looks, and then they are told, hey, you're fine. Your labs came back good. So if you can't see it, the little cartoon next to the information on the slide says, good news. Your lab results look great. Everything is normal. You are the picture of health. So many people that we can visibly see, or just by their symptoms that they're feeling, something isn't right, and they get told lab work looks good. So a lot of times, even just being diagnosed is a lengthy, tumultuous process that can be filled with stress. Next up is just a list of different autoimmune disease treatments. So we might hear about anti-inflammatory drugs, or other type of steroid-like drugs to help decrease inflammation. Sometimes pain medication is needed, immunosuppressant drugs, physical therapy, treatment for a deficiency if maybe there's a vitamin low because of the autoimmune disease. Sometimes surgery is required. I know in my mom's case, because her joints were basically like, and her bones were crumbling, she went through a lot of like foot surgeries and different things to try to piece some of her bones together. We also talk about lifestyle changes and even counseling to help deal with some of the stress, which we'll get into in just a little bit. So I want you to take a look at something. I'm going to flip gears just for a few minutes and talk about more of the environmental components to increase risk and development of an autoimmune disease. So trauma can actually, and toxic stress can actually greatly increase people's risk for many health issues, including COPD, diabetes, obesity, cancer, stroke, having substance abuse disorders, mental health issues, autoimmune issues, I highlighted it in red, and cardiovascular disease. So we're going to link trauma and grief and autoimmune issues together just a little bit in the next several slides. One of the books on our suggested books to read for this class is The Body Keeps Score. That's a great book. I know it's old. I'm sure many of us have heard about it or read it at some point. But it does really, really help when thinking about autoimmune disease. So why is being informed about autoimmune disease valuable to our work? The Body Keeps Score talks about PTSD having a whole body impact. The Body Keeps Score says, if the memory of trauma is encoded in visceral and heartbreaking and gut-wrenching emotions, in autoimmune disorders and skeletal muscular problems, this demands a radical shift in our therapeutic assumptions. It also says child abuse is our nation's largest public health problem. So if you have read this book, you can see how it really discusses more body-based interventions to address physical manifestation of trauma. It gives a lot of great techniques that directly target the nervous system, and methods that help individuals feel safe in their bodies. So the author really discusses breathing techniques, different therapeutic approaches, even a lot about yoga and different things just to regulate and address that manifestation of trauma that happens within the body. Another great book that links autoimmune diseases and trauma together was The Deepest Well. I know many of you heard me present on that in our last specialty last semester, but that was such a great book that I brought it back for some of what I'm doing with this presentation. Um, that book, if you're not familiar with it, really goes over the first ACE study, which was actually conducted by the CDC and Kaiser Permanente. It was the very first study took place between 1995 and 1997. Over 17,000 Kaiser Permanente members participated in the study, and the goal of the study was actually to better understand the connections of adverse childhood experiences and health effects throughout the lifespan. So that really did include a lot about autoimmune disease as well. The ACE study, just to give you a little rundown of how many people reported having adverse childhood experiences back then, 26% of those surveyed reported at least one ACE, 16% of those participants reported two ACEs, 10% of those surveyed had three ACEs, 12.5 participants reported four or more ACEs. The more ACEs a person reported, were linked with an increased risk of health issues. 7 of the 10 leading causes of death can actually be linked back to adverse childhood experiences. In The Deepest Well, Dr. Harris writes, having an ACE score of 2 or more doubles someone's likelihood of developing an autoimmune disease. So let's examine the effects of autoimmune disease on mental health. So let's bring all this back together and talk about how it's pertinent to the mental health world. Research supports that being diagnosed with an autoimmune disease may double a person's risk of developing mental health disorders, including the following disorders: so depression, anxiety, and bipolar. Some people that have autoimmune disorders may report that they had some kind of mental health issue prior to ever being diagnosed with an autoimmune disease. So I just wanted to mention it's almost like a big cycle. Like they're all connected. Sometimes people have them first, and that may have influenced the onset of an autoimmune disease, or vice versa. Somebody may voice, I was never diagnosed with a mental health issue until after I had an autoimmune disease. Regardless of what came first for a person, there does seem to be a very high correlation between autoimmune diseases and mental health diagnosis. Next, we're going to take a look at assessment tools for identifying grief and other mental health challenges post-diagnosis of an autoimmune disease. So the first assessment tool that I have on here is the 5 components of holistic grief scale. This was a good one, I thought, because it doesn't directly in its origins discuss loss of a loved one. Many other grief assessments do. They are primarily for people that are dealing with some kind of loss of a loved one or the death of somebody close to them. This specific assessment is more generalized to just discuss, for the most part, loss. So I thought it was a very good one. It also really is holistic. So it looks at various aspects of wellness and how grief might be affecting that wellness. The others that I put on here, the adverse childhood experiences and the PTSD checklist, because Again, like I discussed earlier, trauma could be a big factor in somebody having an autoimmune disease. The back depression inventory would be a good one, due to the fact that a lot of times depression symptoms can be observed in people dealing with a diagnosis related to autoimmune diseases, generalized anxiety disorder. Seven item would be a great one to do to assess for anxiety symptoms that could be related. The last one I have on here is just a psychosocial assessment. I think a lot of people that deal with autoimmune diseases or the diagnosis of one really struggle with talking to their treatment providers. Sometimes it can be a very tumultuous thing getting a diagnosis, and so just building good rapport with them through a biopsychosocial assessment could be very helpful, to start a good relationship and also just get feedback from the person that you're working with. Ethical considerations related to assessments according to the APA. So we do have the ethical consideration related to multicultural issues or diversity in assessment. Counselors should select and use with caution assessment techniques normed on populations other than that of the client. Counselors should recognize the effects of age, color, culture, disability, ethnic group, gender, race, language, preference, religion, spirituality, sexual orientation, and socioeconomic status on test administration and interpretation. And they place test results in proper perspective with other relevant factors. Next up, challenges related to assessments for individuals diagnosed with autoimmune diseases. Mental health symptoms may fluctuate based on physical health symptoms, so that can be sometimes difficult. Just with the fluctuation of how a person's feeling, their mental health could follow suit as well. Many grief assessments, like I mentioned earlier, were created for use of individuals grieving the loss of their loved ones. And this situation, being diagnosed with an autoimmune disease, we're more assessing the loss of ourselves or what we thought could be while we're trying to figure out who we are post diagnosis. So I think that is a very important thing to remember when assessing for mental health related issues after somebody's been diagnosed with an autoimmune disease. Self report may also just be challenging when somebody's trying to work through something as difficult as being diagnosed with an autoimmune disease. Self report might be very difficult. Many times people have been searching for the answers to how they're feeling, and so feelings can be very mixed. A lot of people, once they have more firm answers on a disease that they've been trying to diagnose or that they've been dealing with for a while with a lot of invisible like symptoms, may feel some relief while feeling very upset. So sometimes that's hard to verbalize. So self-report might be a challenge. Treatment modalities. So cognitive behavioral therapy, allowing them to talk through some things. Mindfulness-based approach therapy, acceptance and commitment therapy, compassion focused therapy has some really good information surrounding it with this population. EMDR or TFCBT, if the person has identified some trauma background and wants to address those things. Group therapy is a big one so that a person doesn't feel so alone. Sometimes it helps to hear from somebody else that may be going through a similar walk. So connecting people with group therapy may be a great way to promote support. And then also coordination and collaboration with other treatment team providers. If a person is newly diagnosed, they may be going through a slew of different providers. It's great to be all together on those kinds of things, so that they can just feel like they have a good team approach. Lastly, because I mentioned that so many people may be affected by an autoimmune disease, I could not leave today without just providing a little bit of hope. So the slide says, you have an autoimmune disease and it's not pretty, but you can rebuild your life in a new way. Living with an autoimmune disease, you are not alone. And the last slide are my references. Thank you so much for listening.